Sure. My name's Kevin Trentino. I'm a Senior Research Fellow with the University of Western Australia in Australia. I do research in patient blood management. I'm also a healthcare data analyst, so I get to work with hospital data and get to work with clinical prediction models, and enjoy doing some research also with digital health and how that interacts with patient blood management. I mean, this conference has been really exciting. There's lots of enthusiastic people. I've been very impressed by the diverse specialties here. So we've got people from different medical backgrounds. We've got surgeons, we've got anaesthetists, we've got hematologists, we've got nurses, we've got scientists. And to see all those people come together and focus on the patient and how each one can play a role in improving the patient's care. It's been a fantastic conference. I've learned a lot from it. Patient blood management is important because people's blood is important, and that's something that's come out in this conference. And so a term that we heard quite a bit, which Sherry Ozawa uses, is about the importance of the blood health of people. And so when people's blood is healthy, they're going to feel better. They're going to be physically healthier. They're going to be emotionally healthier. If they're coming into hospital, they're going to be well prepared for whatever their hospital visit is going to be for, whether that's for surgical intervention or medical treatment. And so it's so important for the person, for the individual. It's important for healthy communities, and it's important for healthy patients. Probably the best thing is for the patient to be their own advocate. Not everyone is aware of patient blood management, the different strategies involved, and how it can benefit a patient. So I think one of the most important things for patients, or even for potential patients, is to be well educated on the topic. So if the better they can become educated on the topic, then the better they can be their own patient advocate, and they can help the clinician in shared decision-making about what they want. And patient blood management certainly is an important treatment to receive. I would say it would be better to be interested in patient blood management, and anyone who's not involved, really, they may be missing out in some ways. Patient blood management is an excellent area to be involved in because it's multidisciplinary, it's about patient care, and we can see that it improves patient outcomes, it also reduces hospital costs, and it improves patient satisfaction. So it's an excellent area to be interested in. Keep it up. It's an excellent area to be in. There's also a lot to learn in patient blood management. I think the field continues to grow, and it's very important to find others who are like-minded. And patient blood management, because it revolves around patient care and the importance of the patient's blood, it is multidisciplinary. So surround yourself with others, even outside your discipline, who are interested in the patient's blood.